Hello everyone. Today's video is about rheumatoid factor and whether if that's elevated, if that always means it's rheumatoid arthritis, or it might be related to other things, possibly related to complex chronic illnesses. Just before jumping into the video, if you don't mind taking a quick moment to please like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. And as per usual, nothing that I'm saying should be construed as medical advice. This is for informational purposes only, and if you need medical advice, please talk to your healthcare provider to get that advice. So somebody posted this question on one of my other videos, and it says, will you please explain the specifics all about high rheumatoid factor? My rheumatoid factor was 37, and over a year's time now it's 26. I have Lyme disease and other things I'm working through, and I'm really hoping I don't have actual permanent rheumatoid arthritis. Do you believe that rheumatoid arthritis is not really a real diagnosis, but rather it is a symptom of immune dysfunction from something else, and that for many people with Lyme disease, the systemic arthritis can go away? In other words, just because someone has a little higher rheumatoid factor doesn't mean they have permanent rheumatoid arthritis, right? Question mark. So thank you for the question. I just need to put my computer to sleep so that it does not die. All right, so yeah, rheumatoid factor is an interesting one because it is certainly most commonly thought of as being an association with rheumatoid arthritis, although there are people with seronegative rheumatoid arthritis that don't have rheumatoid factor, especially in juvenile rheumatoid arthritis, where in kids they're much more commonly seronegative than adults are. But rheumatoid factor can be elevated in lots of other conditions. It is elevated in a number of other autoimmune conditions, but most commonly with rheumatoid arthritis. When this question came up, I thought to myself, I know I've seen that rheumatoid factor is elevated in other things before. I've seen literature that rheumatoid factor is elevated in other conditions too, but I thought I'd haul out my handy-dandy lab reference guide just to see what is on the differential diagnosis list, my little desktop guide that lives on my desktop. I am not sponsored by Mosby's, but it is a very lovely diagnostic and laboratory reference guide. So according to this, the things that can cause rheumatoid factor elevation in addition to rheumatoid arthritis and other autoimmune conditions would be chronic viral infection. So I have seen some literature that say Epstein-Barr virus, for example, and evidently other viruses too can cause elevated rheumatoid factor. Also subacute bacterial endocarditis, so you probably know if you had some inflammation of your inner heart lining. Tuberculosis, not a common one in this neck of the woods anyways, thankfully. Chronic hepatitis, dermatomyositis, which is an autoimmune condition, and then they mentioned some other autoimmune conditions here as well. And then also leukemia, cirrhosis, syphilis, and renal disease. So a whole bunch of things can cause elevated rheumatoid arthritis. Certainly not insinuating that the person asking this question has any of those really nefarious conditions, but it is something where, in my practice, if a patient has some mildly elevated rheumatoid arthritis, mildly elevated rheumatoid factor, then I'm not immediately thinking like, oh my gosh, they must have rheumatoid arthritis, especially for patients where the level's quite low, and if it's like kind of going down over time, it's in my experience like really unlikely that that would be a definite indicator of there being rheumatoid arthritis. Now, with that being said, and I closed my computer, so I don't have the question up to reference here now, but if memory serves, I'm paraphrasing a little bit, but the person was asking, is rheumatoid arthritis like actually a real thing? And like, it definitely is. It's definitely an autoimmune condition that exists. I've treated many a patient with it over the years, and it's definitely a thing. But rheumatoid factor is not 100% specific for rheumatoid arthritis. In terms of there being kind of overlap there, which there's kind of some question around that too. Some folks with elevated rheumatoid factor who have fairly widespread joint pain, that joint pain could certainly be due to other things. It might be from the chronic viral infection that they have, or it could be related to the Lyme that they have, or it could be related to the mold toxicity that they have, or other things. So there are plenty of things that can cause widespread pain, joint inflammation, things like that. So it's RA, rheumatoid arthritis, is definitely a real thing, but rheumatoid factor is not super specific. So if I had a patient in my practice and they had a mildly elevated rheumatoid factor and they had lab tests or clinical history that significantly or strongly suggested that they had some type of a chronic infection, I would kind of lump it in that category, and I would not be, sitting there counseling them saying like, all right, like, you definitely have RA, your joints are going to be taken a licking over the years, let's try to, damage control as much as we can. Like, I'd be thinking more like, this is probably more of a transient thing that's related to the underlying infectious processes happening here. Quite frankly, to my understanding, they have not looked at whether, maybe somebody has, I haven't seen it, but I don't believe, I've not seen any research literature indicating that they've looked at rheumatoid factor elevations in people with, say, mold toxicity or, elevated heavy metal issues or mast cell activation syndrome or conditions like that. If anyone listening to this video is aware of such studies, please let me know, send them my way. I'd be very interested to take a look at that. But I don't think that's been studied. My handy dandy reference guide there, it's, I've had, that's from my naturopathic school years. It's about 20 years old. They weren't looking, would not have been looking at those types of things back then, and I doubt if the updated version of the Mosby's would be looking at that either, because of course these things are very much under mentioned in the kind of conventional medical end of things, or mainstream kind of medicine side of things. So anyways, rheumatoid factor might be implicated in a lot of other things. A good sort of sister example to that would be anti-nuclear antibody, or the ANA level, and with the ANA is also elevated rather in like virtually all of the same things on that list, certainly, across autoimmune conditions, but that can also be elevated, sometimes just idiopathically, they don't know why it's elevated, but it can be elevated for lots of different reasons too. So I've had plenty of patients who come in saying like, so I have all these chronic symptoms, nobody's been able to figure out what's going on with me. I've had all the tests done, but and everything comes back negative. I'm the healthiest person in the world on paper. It's very frustrating because I don't feel like the healthiest person in the world on paper. But the one thing that did come back was I had this, positive ANA. So like, we figure there's something autoimmune going on, and it's like, yeah, maybe. But then they get further testing and they can't seem to find any evidence of any other self antibodies, so to speak, auto antibodies is the word I was looking for, that would be more specific for lupus or RA or what have you. And I think in a lot of those cases, when we then go on and do our testing and treatments, it's like, oh, it was a chronic infection, it was mold, it was something else, and then it's like that's probably what was elevating the ANA in the first place. So with these autoimmune antibodies, they are, I think, very useful to run, but especially in my practice, if the levels are fairly low and there's not really a super consistent clinical picture that would suggest that, like, oh, you have elevated RA or elevated rheumatoid factor, and rather, if there's a picture where there's elevated rheumatoid factor, but it's not really like a textbook RA case, I'm thinking like, well, maybe it's related to something else, and oftentimes it is. So I hope this information was useful. Thanks for the question. It was fun to have an excuse to bust out my Mosby's. I don't have to open it all that often, and because I've been doing this for a little while now, but it's on my desk for a reason, that desktop guide, and thanks for giving me an excuse to crack it open and look up the differential for elevated rheumatoid factor. If anybody has any questions on this topic or anything else, please post in the comment section below, and I will do my best to answer as soon as I can.